Good morning, everyone, and welcome to this morning's live section of the Oversight and Engagement Board for today. We are being streamed live on YouTube. Welcome to all those joining us on YouTube. We'll come to the agenda. I'm going to go to the minutes of the previous meeting, which was held on the 18th of March and in the public session, and I'm going to assume that those are as read unless someone puts their hand up, in which case we will sign those off and come rapidly to the weekly surveillance report from our Director of Public Health, Lucy Whiteman. Good morning, Lucy.
Morning, Councillor Morrison, thank you. So this is the surveillance report from last week, and it contains data up to the 21st of March. So the key messages obviously at that point in time were that we had for that following weekend the continued stay-at-home order until the 29th. That's obviously now changed. We are able to go out and about, still obviously with significant restrictions, so groups of 6 outside, the rule of 6 outside, or 2 households meeting outside. Obviously, we've also seen some other sporting facilities open, but again, we're just reinforcing the key messages that you must maintain your distance whilst outside. Where you aren't able to, you must obviously still be continuing to use your face mask and obviously regularly washing and sanitising your hands. From a point of view of the case rate, we are seeing a slow but steady increase in cases, in part due to the reopening of schools, but we are still seeing continued transmission within and between households. So that does demonstrate some level of non-compliance still. We are providing obviously further testing facilities to ensure that those who are having to go out and about, either to work or to facilitate childcare responsibilities, are able to access testing to identify whether they're contagious, and obviously to then self-isolate as required to break that chain of infection. This is going to be particularly important as we continue through the roadmap out of lockdown. The more facilities that we have open, the greater the risk of contagious transmission. So we do need to be encouraging everybody who has access to testing to do so on a regular basis, please. The good news is, though, that despite an increase in cases, we are still seeing very few of the old and vulnerable affected. The case rate in the over 60s is generally still on a downward trajectory, and the number of vaccinations, particularly in those older and more at-risk age groups, continues to go up. So that is good news. That is resulting in reduced admissions in hospitals, but also a reduced number of deaths. So good news on that front, and long may it last. So if we go to the first page of data, please, Cheryl. So for those that want to have a look at the full report, it's available on the NCC website and has all of the information about the changes out of lockdown, and obviously gives you links to that information to make sure that you're well informed about what you are and aren't able to do over the coming weeks. But as you can see, data for the overall cumulative number of cases has now surpassed 47,000. Which obviously is quite a considerable number for a county the size of Northamptonshire. Of that, the week up to the 21st of March, we had 589 cases, which was a small increase on the previous week. We are still seeing, as I said, week-on-week increases, and those are actually increasing in their sort of steepness from a point of view of increases. So again, we do need people to continue to be very, very aware and be very considerate and careful when they're out and about as these restrictions are lifted. If we go to the next slide, please. So from a point of view of overall rates, we have got such significant variation in the county. The latest data actually from yesterday showed that there's an 8.1-fold variance across the county. So from areas like Daventry and South Northamptonshire with very low rates, excuse me, up to Corby, whose rate is now well over 200 cases per 100,000. We have got over an 8-fold difference between different areas. We do recognise that there's a different level of risk in different areas because of the demographic, but it does also reflect the fact that we've got different levels of compliance with the restrictions. And if we do want to actually continue to take those steps out of lockdown, we do need people to be conscientious and considerate and continue with best practice hand space, even when out in the open air, but also obviously to engage with the testing facilities that are available across the county and or delivered directly to your home for those who can't get to testing stations. If we go down to the next slide, please. So this is the crude numbers. Again, you can see we've got a decrease from a point of view of us overall, but we've got increases in key areas in Northamptonshire. And as I said, that's changed considerably in the last week. The more recent data is showing a much steeper increase in cases, and nearly all boroughs and districts affected in one age group or another. If we go on to the next slide. So again, any of the lines above the middle zero axes does demonstrate an increase in case rate change compared to the last 7 days. You can see we had a period while we were in lockdown where we had a much greater reduction in the number of cases, and since schools have returned, and indeed since in the last few days, just even more recent data, as I've mentioned, is starting to show that significant increase again. We do need to continue to be careful. We don't want to end up taking large backward steps, having gained so much that you can see there in the lines under the zero axes in January and February. We don't want all of those sacrifices to have been for nothing. So please do continue to engage with testing services, isolate when required. And as I've said before, engage in the best practice of hand, space and space, even when outside. If we move on, please. So this does show the variation across the county. And the good news is obviously we have got some areas that are at the England average or even below. Our challenge continues to be that in our more deprived and more densely populated areas, we have got some challenges from a point of view of increased case rates. And therefore we need to make sure that we are directing all of our efforts in those areas. And we have redoubled both warden patrols. The police have got additional patrols in the areas where we've got higher rates. We've got environmental health officers engaging with all of our higher risk settings. We've got tailored communications and engagement work going on in Corby and in other areas that are being more affected at the moment. And again, we have also ensured that testing facilities are available, and more of them, in fact, in those areas that are greatest affected. So again, asking people to ensure that they are well informed about the current restrictions, what they need to be doing to ensure that they and the people they care for are safe. If we move on, please. So we've been using this now for a long time, and again, we've still got that really sort of static and high number of cases in the working age population, the 30 to 39-year-olds, again, being the age groups that are affected the most, both in males and in females. But again, you can see the impact of schools reopening with the younger age groups. We are still seeing a lot of asymptomatic carriage, particularly in that younger age group. So those lateral flow tests, those asymptomatic testing sites are going to be key for us obviously bending this trend in Northamptonshire. The good news, as you can see from the older age groups, is we've still got far fewer older people affected. That is obviously as a direct impact of the vaccination programme being rolled out. But we do need to be cognizant of the fact that shielding has stopped as of today, and therefore making sure that those vulnerable do obviously continue to be protected wherever possible. And we all have a personal responsibility to help do that. If we move on, please. So this is one of the benefits, as we've talked about before, of the vaccination programme being rolled out and our most vulnerable and older population obviously being vaccinated first. The key aim of the vaccination programme as it stands at the moment is to reduce mortality, and you can see here it's clearly had an impact. It's bringing down all of the number of hospital admissions in both of our acute trusts. The latest data at that point was 49 beds occupied by COVID positive patients, and that has decreased further. On the next slide. You'll see the number of deaths again broadly across the county that has decreased, again as a direct result of the vaccination. But you can still see we've got some fluctuations in the more densely populated areas and those where we've still got high case rates. So people do need to remember there are still some significant risks to people who are more vulnerable. And therefore we do, as I said, need to take personal responsibility to help protect those who may not be able to have the vaccination or may not have had the vaccination yet, or indeed are one of the unfortunate ones where COVID just happens to have more significant impact on their health, even if they're younger and fitter. We are all at risk. We never know what that level of risk might be. So please, honestly, continue with that best practice. If we go down, please. So the good news is that obviously we've got a high number of schools open. Yes, they are still obviously seeing cases that are being identified through the lateral flow testing process. And that means that we obviously are able to isolate people and stop that onward chain of infection. It does cause a little disruption. And obviously you can see that we've got 4 education settings closed at the time that this data was published. But broadly, we've still got good numbers of attendances in schools, and long may that continue. We appreciate, obviously, the efforts of all of the schools and indeed the cooperation of the pupils and their parents and others in their care bubbles where they're undertaking that testing. It is helping us maintain those settings in as safe a way as possible. And lastly, if we have a look at outbreaks, if we go down a couple of slides. So outbreaks, again, we see a bit of a fluctuating picture. They're sort of going up and down each week, and we will continue to see that as we see different settings opening over the coming weeks. Again, we've had that reduction, which is good news in care settings, and again, associated with vaccination rollout, both for staff and for residents. People will notice that we've obviously had more outbreaks in education settings, and we continue to have small outbreaks in workplace settings. As I said, we are expecting to see that potentially increase as different settings are opened in the roadmap out of lockdown. What we do need to do, obviously, is try and mitigate that risk, and wherever there is an outbreak, get those people tested as soon as possible and try and contain it so it impacts as fewer people as possible. We do want, obviously, our county to continue to come out of lockdown, but it must do it safely. So everybody that can engage in a testing programme is encouraged to do so. If they can't get to testing sites, as I said, on our NCC website, which will continue to operate and can be accessed either directly through the NCC website address or through the two new unitary website addresses, you can still obviously get access to all of the COVID information, including how to get those tests either delivered home or indeed pick them up from one of the testing sites so that you can test at home for the coming weeks. If I stop there, Councillor Morrison, and see if there are any questions.
Thank you very much, Lucy, as always. Some encouraging figures there, but no time to rest on our laurels, definitely not. Still got to keep up the rules and as they unlock us. I'm looking around the room, no questions, in which case we'll come to you, Lucy, for testing and contact tracing, and then we'll go to Kath for a comms update. Lucy.
Thank you, Councillor Morris. Just find the right information. So the contact tracing update, we've obviously got good rates and we've had that local partnership arrangement now for quite some time. Our most recent performance is 91%, so that's the joint second highest in the region, and we continue to encourage the team to look for new and innovative ways of making sure that we are obviously getting in contact with as many cases as possible to get the details of the people that they may have been in contact with and potentially may have infected. People will have heard, I think, on the news nationally today that there are some really quite shocking numbers from a point of view of the sample that was interviewed. There were very few people, or many fewer than we would want, who were actually complying fully with that isolation requirement, and indeed even the testing in the first instance. We have seen the benefit of testing when we had the nation's largest outbreak last year. We identified people who may have been at risk, we got them isolated, we provided them with support, which again can be accessed through the NCC website if they do need to isolate. But it is the only way that we can break the chain of infection and get back on top of our rates. Obviously for areas like Corby, that's particularly important at the moment. One of the good news stories from a point of view of contact tracing is that we are seeing more people disclose information about who they may have been in contact with when indeed one of our representatives does give them a ring. That's really important. We don't want anybody to be unaware that they may have been in contact with a case. We are protecting obviously them and yourself as the potential person with the virus. So please do engage. We've seen really positive results. And as I said, the only information we want is around protecting yourself and the people that you care about. We're not interested in any other information or pursuing any reason that you may have been mixing with them. This is about containing that outbreak and that virus spread, as we talked about. Just a quick reminder from a point of view of testing. We still have a number of PCR testing sites. So those are the testing sites for people with symptoms. We've got the regional testing site in Kettering at the Kettering Conference Centre. We've got local testing sites in Corby, Daventry, East Northants, Kettering, Northampton, Wellingborough and South Northants is being scoped. So, we're making sure that we've got really good coverage. While South Northants doesn't have a semi-permanent local testing site, it does currently have a mobile testing unit, as does Corby, East Northants and Northampton. So we're covering some of the more densely populated areas with both local testing sites and mobile testing units. We've got good uptake from a point of view of those testing, PCR testing sites. But again, there is capacity in the system. And while we're starting to obviously mix within the restrictions outside in groups of 6 or perhaps with another household outside, although I would obviously encourage everybody to maintain their distance, wear face masks where appropriate, and continue to wash and sanitize their hands. If anybody does develop symptoms, they must go and get a test and isolate until they get that result, please. From a point of view of the rapid testing, so that's testing for people who don't have symptoms, that gives you a result about whether you're infectious within 30 minutes. We have got asymptomatic testing sites, 2 in Corby, 1 at Lodge Park and 1 at Hazelwood Centre, 1 in Northampton, 1 in South Northampton, 1 in Wellingborough, 1 in Daventry. We've also got sites in East Northampton, Kettering being scoped. But as I've mentioned before, most employers are now able to engage with a testing programme for their employees. And again, we can provide information if your employer is not aware of that. But you can obviously drop into those sites that we've just mentioned twice a week for testing. But you can also click and collect if you go onto the Northamptonshire County Council website to pick up tests to be able to do this at home should you not be able to attend sites on a regular basis. And there is also a home delivery service if you're unable to leave at all. So lots of options for people to engage in that testing. And it does, again, just give us the opportunity to identify where COVID is, make sure that we get those people isolating. Support is available again through our website for food, for potential funding, for pharmacy deliveries, etc. And that's the only way we'll break the chain of infection and get the rates back down in places like Corby. So please do engage. Any questions, obviously people are welcome to contact the public health team or their local environmental health officers.
Thank you very much, Lucy. Some very good stats there, particularly, I know you won't say it, but we are one of the top rated tracing counties in the country. And it's very, very good to know that. And we're being used as best practice elsewhere as well. So really good news on that front, as always. And so thank you to the team for all their hard work that continues. I'm going to see if there's any questions. Doesn't appear so, in which case I'll come to Kath Hall for a comms update. Good morning, Kath.
Good morning. Thank you very much. So yes, I will take you through the campaign that we're launching this week, which is called Take Care in the Open Air. So we're launching a range of messages for people to help them be safe as they start to meet outdoors and potentially with more people. So we've got messages to remind people to stay socially distanced from those that they don't live with, including family members, to still keep 2 meters away at this stage. More guidance will be provided on what you can do with family that you don't live with further down the line on the next steps of lockdown. Particularly keen to push out the guidance around meeting in private gardens, the temptation to share items or relax a little bit more. So we're trying to remind people not to share items, to keep the distance, to avoid close face-to-face contact, just to stay safe. We're also pushing out messages around discarding of face coverings safely within a bin. We've all seen the littering problems this week, not just in Northamptonshire, but across the whole country, and just reminding people to put their litter in a bin or take it home with them. Also, we have some messages around washing hands regularly, especially if you're out and about touching surfaces such as railings, gates, play equipment, pedestrian buttons, things like that. Carry hand sanitizer with you as a normal now, and to use that regularly, and to try and use contactless payments where possible to avoid handling cash, which can obviously increase the risk of spreading the virus. So those campaigns should be out and about across social media, across the bus stops, on the radios, Heart, Global, NLive, Inspiration FM, and a couple of others. And you will also see them on Correx boards and banners in open spaces over the coming weeks. So hopefully people will be clear about how to stay safe outside. In addition to that, we've got some Easter messaging across social media, which again just reminds people what they can and can't do over the Easter period and how to take care during that time. And we're also working on some preparation for step 2, which is coming on April 12th, subject to data meeting the requirements. There's new town centre rebranding that's being developed, nice, bright, vibrant colours that you'll start to see across town centres in the county. And we're also looking to support Ramadan, which also starts on the 12th of April. So lots coming up on that date. Just in terms of Ramadan and BAME community messaging, we are supporting some messaging around the vaccine safety during the Ramadan period, and also around encouraging those communities supporting Ramadan to do so safely and within the guidance. And we're also looking to work with more Eastern European communities. There's some vaccine hesitancy within those communities. So we're looking to do some of the engagement events that we've done with other communities, question and answer sessions, and we're looking to put some asset packs together for leaders, community leaders, faith leaders who really are doing a great job in helping us to share those messages. We also have a digital van, a GOMO van, which you may have seen around the county. That shows lots of different messaging in lots of different languages, and we're exploring the option of using voiceover with that as well to share some messages, and that can be done in any language as well. And then finally, we've got a young people's campaign, so we have a different set of messaging to try and reach young people, which is a little bit more dynamic, more colourful, and there's a separate landing page where we've got some information for young people about COVID guidance. That's called thisisnotagame.co.uk. The branding's quite black with bright pink and blue imagery on it. And on that landing page, you can play games and interact with other people as well. So it's quite focused at young people. So that will be promoted through the new North and West Northants social media pages. And we're also continuing to work with our influencer, Tessa Bear, who is a popular influencer who lives in Northamptonshire with over 6 million followers. And she's kindly agreed to keep working with us on sharing some messages. She did a testing video for us to show us how to do our lateral flow device testing. And now she's doing some messages for us about meeting outside safely. So that's probably just a little bit more testing. We're doing quite a bit of promotion around testing. As mentioned, there are various click and collect sites where people can go and pick up testing kits. So we'll do some promotion of that over the coming weeks. And we're also promoting our community testing sites as well. That's probably us for now.
Thank you very much, Kath. Some really good work as always from the comms team to keep these messages pertinent in everyone's minds, particularly as we come towards the Easter weekend, which no doubt will hopefully won't lead to too many people breaking the rules. Hopefully no one will break the rules, but you never know, do you? It's going to be interesting to see. So let's have a look around. There's no questions, in which case I will close the meeting. Thank you very much, everyone. Oh, Lucy, you wanted to come in. I do apologise.
No, it's fine. I wanted to add something. I'm conscious of the fact that I have been contacted with regards to data reporting and the changes to the local authorities. So I thought it was just worth mentioning in this public section as well. Obviously, we've been informed at this point in time that obviously government at a national level will start to report when the data flows from today. As the 2 new unitaries. Now we're very cognizant and talked about this and agreed a number of weeks ago that we need to provide some granular detail. We are, as I've talked about, very clear that there is significant variation, with Corby still at the top of the table from a point of view of an area of concern. We want to continue to provide the public with transparent reporting so they can understand the risks to themselves and again the variation in the county. So wherever possible, our local reports will continue to contain all of the borough and district information in the same way that it has done before. We will then report, as the government will be, as the 2 new unitaries, as well as at a county level. So we will be providing as much data as possible in the same format with the 2 new unitary footprints included until further notice. But just to let people know that that is our full intention in order to ensure that there is transparency. As I said, we have been informed that the government will naturally start to report as the new unitaries, as it does with all of its council footprints. we've yet to see that follow through on the data, but I'm sure that will be happening in the next couple of weeks. So you will get both sets of information going forward.
Brilliant, thank you, Lucy. And I think that's really key to help us understand what's going on going forward, and certainly no attempts to try and deviate from the facts that are very obviously in front of us. So very clear, precise information, as we always get from you anyway, Lucy. I don't think there's any doubt that the figures are correct or accurate. They always are. So thank you very much for that. I will close the meeting now unless anyone else has got a question or anything like that. The next meeting is proposed for the 29th of April, which seems a long time away, at 8:30 a.m. What I would like to say is have a great Easter weekend. Stay safe and stay well. I think the weather may help us this weekend, as it's looking rather grim, but enjoy yourself.